Hi, I'm Dr. Brebnor. I'm an OBGYN with the Holy Cross Medical Group. I am an obstetrician gynecologist and I provide comprehensive care for all women. I provide prenatal care, I perform Pap Smears as well, and other gynecological issues such as fibroids, abnormal uterine bleeding, ovarian cysts, and many more. However, today I would like to speak on a topic which is a particular interest of mine. The topic is chronic female infections, and these are infections of the lower genital tract. These infections can include yeast infections, bacterial infections, and sometimes yeast and bacterial infections can become recurrent. And when these conditions become recurrent, they can actually interfere with one's day-to-day living. So other common issues include Lichen Sclerosis, Lichen planus, Lichen simplex chronicus, and these conditions can be managed, treated, and can eventually lead to an increased quality of life. I currently see patients at 2 locations. One location is right off of the campus of the Holy Cross Hospital. It's in Building B. And I also see patients at the Women's Center, which is our HealthPlex facility. I usually see patients at the Women's Center on the first Wednesday of the month. I particularly see patients who have lower female genital tract disorders at that time. So feel free to come by, schedule an appointment if you need to see me. All right, any questions so far?
Yes, so what's the best way to prevent, say, female itching in the first place?
So the question is, what's the best way to prevent female itching in the first place? Very good question. So commonly, we as human beings have this way that we would like to over-clean. And over-cleaning can cause irritation and can cause problems. So for example, on a daily basis, the cleanser should be a mild cleanser, a mild soap, if any soap at all. One should avoid wet wipes. They're not good for you. You should also avoid using very scented detergents, dryer sheets, fabric softeners. These can lead to irritation, especially if some people are more sensitive in the genital area. I vehemently recommend against douching and against taking bubble baths. Again, just the extra fragrance and removal of the natural vaginal flora can lead to chronic conditions such as the yeast infections and bacterial infections.
And then what about, what can you tell us about things like endometriosis and preventing endocrine cancer, some of the cancers in women? Can you talk a little bit about prevention in those? We know it's a little off topic, but in terms of just women's overall health.
In terms of women's overall health, I do recommend that you come in to get your routine Pap Smears, because the Pap Smears is the screening tool for cervical cancer. And when you come in, we usually check and we can figure out if the cells are negative or if there's some abnormal cells. A lot of times we do have abnormal cells on the Pap smear, and that does not mean that someone has cancer of the cervix. However, it means that there should be more monitoring to ensure that these abnormal cells do not become cancer cells. And actually, could you repeat that question again so I can repeat it so everyone can hear it?
Just what can you do to help prevent things like endometriosis, endocrine cancers, some of those conditions that are unique to women?
So the question is, what can one do to prevent conditions unique to women, such as endometriosis and cervical cancer, endometrial cancer? So I answered the cervical cancer component, where you should get your routine Pap smears. And when it comes to endometriosis, unfortunately, we can't prevent endometriosis. However, if you are experiencing symptoms such as severe cramping at the time of the menstrual cycle, or painful bowel movements, or pain with sexual activity, these can be signs of endometriosis. If that's the case, you should simply follow up with the obstetrician gynecologist for evaluation.
We also have a question. What do you think about Dominos? Do you know what it's D''MANNOSE? Not, all right, I'll ask them to elaborate.
Please
So,
elaborate.
Yes, to elaborate. While we do that, can you talk a little bit maybe about the difference between vaginitis and bacterial vaginosis? And is there a difference?
So the question is to speak about vaginitis and bacterial vaginosis. So in general, an infection of the vagina is a vaginitis. The two common infections that we treat include yeast infections as well as bacterial infections. Yeast infections occur, you know when a yeast infection occurs because the symptoms include intense itching as well as thick vaginal discharge. Typically, some of the things that can lead to yeast infections, again, could include using different wet wipes, different products, or keeping on wet clothing after working out or after swimming in the pool. It's recommended that you change out frequently rather than staying in wet clothing. So the yeast infection is more of the itching scenario. The bacterial infection, commonly known as bacterial vaginosis, the main symptom that one would recognize is a vaginal odor. Some have described this odor as fishy, rotten egg smell. I've even heard it smells like a corpse. And if you have such an odor, you definitely want to follow up with your gynecologist as soon as possible. Again, a bacterial infection of this nature, bacterial vaginosis, it is not a sexually transmitted disease, but does require treatment. And we do have basic antibiotics that could treat bacterial vaginosis quite well.
So we did get some clarification on the D''MANOS. It's a supplement, cranberry sugar extract. It's packaged as the nutritional supplement D''MANOS, sugar monomer of the aldohexose series of carbohydrates. Does that help?
Okay, so the question is about D''MANOS. It's a nutritional supplement that has cranberry and sugar extract.
And used to help prevent or heal UTIs.
It is used, and the question is, its use in treating and preventing urinary tract infections. So in general, urinary tract infections, another infection that can affect, that's the bladder. And these typical symptoms will include burning on urination. Sometimes you can have discolored urine or a different odor to the urine. And sometimes people can have pain in the bladder after urination. The cranberry extract can help because how cranberry extract works in general is that it causes the bacteria to sort of detach from the walls of the bladder, and thus your symptoms will improve. However, it is not a treatment. If you do have a urinary tract infection, it is best to seek medical advice, medical care, so that the infection can be treated with the appropriate antibiotics. Sometimes if urinary tract infections become recurrent, then we will send off a urine culture just to ensure that we're using the correct antibiotic to eradicate the bacteria.
Okay. Sometimes vulvar itching, it's worse at night. Why is that?
The question is, sometimes vulvar itching, it is worse at night. So that's a tricky one. And I would say if the vulvar itching is worse at night, then definitely come see your gynecologist, come see me, because sometimes we can be getting into the realm of other conditions such as Lichen Sclerosis and Lichen planus. Lichen Sclerosis is a chronic condition. The cause is unknown. However, there is intense itching, which is worse at night, and typically it's a very characteristic exam. Once I do the physical exam, that I can tell that it's lichen sclerosis. Sometimes early lichen sclerosis may not have all the features, and sometimes a vulvar biopsy will be needed to sort of solidify the diagnosis. And if that's the case, if it's something else like lichen sclerosis, then the treatment is different. And the treatment is a topical steroid, which is applied nightly until the symptoms resolve, and then maintenance therapy is used for lifelong. Okay, and I always advise, if there's nighttime itching, that you should definitely make sure to cut your nails. Like, you should never have long nails, because you can inadvertently scratch and damage and cause ulcers at night. So if you have this prolonged particular itching at night, then you definitely need to come see a gynecologist.
Do age or menopause play any role in female infections or the itching?
So the question is, does age play a role in female infections and itching? Absolutely. So once the menopausal transition occurs, what's happening to the body? What's happening is that the amount of estrogen has decreased. When this occurs, the actual tissue of the vagina, the vulva, changes, and with that, some of the changes of menopause occur. The main complaints that people will talk about would include itching, irritation, rawness, and just intense pain and burning with sexual activity. So I think this is an important conversation, because typically everyone thinks, not everyone, but the general idea is that when there's itching, everyone automatically thinks that, oh my gosh, it's a yeast infection. However, that's not always the case. It could be the other conditions like lichen sclerosis, or it could be due to the changes of menopause. And as you can tell, all of these treatments are different. If it's an infection, like a yeast infection, that's the candidiasis, then an antifungal is the treatment. If it's one of the chronic conditions like lichen sclerosis, then the treatment would be a topical steroid applied per your doctor's orders. And if it is that it is the genitourinary syndrome of menopause, which is the changes that occur due to menopause, then the treatment varies. We can start with general lubricants, and if that does not work, then there is replacement vaginal estrogen that can be used to alleviate the problem.
And can you just talk a little bit about the importance of coming in for either an annual exam or regular screenings?
So the question is to speak on the importance of coming in for regular annual exams or regular screenings. It's highly important that one comes in for the regular screenings. Too often I hear people say, oh my goodness, I didn't want to come in because I didn't want you to find something. However, that's what screening is. And in fact, what I should say is sometimes with screening, if something is found at an early stage, then it can be taken care of without too much detrimental effects. So just let's say, for example, I always talk about cervical cancer screening. Again, if you get your Pap smear on a regimen suitable for you, some people based on their previous Pap smears, it may be yearly Pap smears. Other people could be every 3 years for the Pap smears. It's actually quite individualized. You should come in and get the screening so that if there's anything found, it can be taken care of in advance. If we wait 10, 20 years without a screening and there are abnormal cells present, then these cells can go to cervical cancer cells.
We did have another question about solar ray yeast cleanse. Are you familiar with that?
Solar ray yeast cleanse. I am not, just asked for a little bit more clarification.
Okay.
Wow, where are we finding these things? I like to know all the different treatment options out there because we can get to figure out what's right for you.
Right. Well, can you talk a little bit about that with things that you might read in the media or on social media? How do you determine whether something is an effective treatment and just not something like fly-by-night?
Okay, so the initial question was about solar ray yeast cleanse, and then also to figure out with all the different products out there, how do you figure out what's helpful versus what's, for lack of a better word, a gimmick. So, we'll figure out a little bit more about what this solar yeast cleanse is. However, as I alluded to before, I like to say less is more. So the less you do, the better off you are. The general daily regimen should be just water cleansing the outside, or water and a mild soap. The soap that I usually recommend the most is Cetaphil because it has very few ingredients in it. It is unscented and it's very light, but it cleans very, very well. So it doesn't cause that much irritation. And in general, if there's an infection, the infection should be treated. But I'll also say sometimes your body, once the pH normalizes, because like yeast infections, bacterial infections is sort of a pH imbalance, and after a while, your body can eliminate a yeast infection once the pH rebalances. However, some of the pH products out there do not work to rebalance your pH. It just sort of throws the pH off a little bit. Feminine products like the feminine sprays, what else is out there? There are a lot of feminine products on the aisles. And honestly, you can really save your money and not use any of those products because they usually cause more problems than any good.
So a quick search shows that the Solar Yeast Cleanse is basically a dietary supplement that is supposed to prevent yeast infections. It's a dietary supplement in a capsule form.
Okay. The Solar Yeast Cleanse is supposed to be a dietary supplement that's supposed to prevent yeast infections. I guess the one thing that comes to mind will be probiotics, because a lot of people take probiotics because it's all about getting the bacterial flora correct, so to speak, and when the flora is balanced, then the vaginal pH is balanced, and then you have less infections. However, the studies are mixed on probiotics. If someone is taking probiotics and have a healthy vaginal flora, I allow them to continue probiotics because if it's working for you, you can certainly continue it. If it's not causing any harm, it's a simple probiotic. However, the issue is that most probiotics are not live cultures, and live cultures are what's important for the vaginal flora versus dead bacteria. So most of these supplements and probiotics in general don't help, but if it's working for you, I don't take it away from you.
So in terms of any key takeaways that you would want people to leave with, what would those be?
So the key takeaway would be, the biggest would be, is less is more. Do not over cleanse. You can go straight past the wet wipes and all the extra feminine products on the aisles, and you can save yourself some money by simply cleaning with water only, or if you need soap, a gentle soap cleanser. That'll be the main takeaway. Thank you.